I'm recording this video from my lovely campsite in Cornwall, where we are on our family holiday. And basically I'm doing this because I'm trying to do this family holiday while eating a high fruit, low fat or vegan diet. And I'm doing it kind of because the UK FruitFest is going on at the same time, and I wanted to go, but I wasn't able to go because we'd already booked this holiday, and so I wanted to do it in spirit. And it's probably about the 5th video I've recorded where I'm talking about this diet and my sort of various efforts to do it. So it's been something I've been kind of experimenting with on and off for a while. So I guess I'd hoped that the Fruit Fest for me would be a new beginning, because I kind of keep starting and stopping and starting and stopping, and I'd like to say that I'm starting again and I'm not going to stop, but obviously who knows what's going to happen in the future. Anyway, I mean, one of the brilliant examples of how we just never learn, or at least we learn very slowly, is yesterday. So I recorded my video yesterday morning feeling amazing, and over the course of the day gradually got a really terrible headache, which I think was probably caffeine withdrawal. And I don't drink that much caffeine. I didn't think I did anyway. I kind of have a bit of green tea and some dark chocolate, but I haven't really been drinking tea or coffee, so I'm certainly not an 8 cups of coffee a day person. And towards the end of the day, when I was really thinking, oh my word, is this meningitis or something hideous like that, I remembered that the last time I had a caffeine withdrawal headache, I wondered if it was meningitis as well. And then I didn't drink caffeine for a while, and then it gradually crept back in again, partly just trying to do too much in my life, probably trying to keep myself going beyond what I really ought to be doing, working night shifts, working 12-hour days, and trying to be a mum. So I guess you just end up talking yourself into thinking that it's okay. And one of the things that's been interesting for me about thinking about it is it occurred to me that actually we don't think of caffeine really as the really powerful drug that it is. And it I'm trying to think of the way to explain this. So basically we have receptors in our body, on our cells, which any drug, any substance that causes a physiological effect will bind onto, sort of like that. And when you detox from caffeine and you don't have any in your system, all those receptors are empty and they're all sitting around waiting for that one cup of tea, that one cup of coffee, and the minute you have it, they're all full again. And so you're back to square one literally that quickly, because from the point where you've had that one, it's all about withdrawal then after that. So the minute that they're all full, the minute that you've had that one cup, then you're back to the point of having to wean yourself off it again, because as it comes out of your system, you start to get withdrawal symptoms. So I think I don't know if that makes sense, but what I'm trying to say is, certainly for me anyway, I can't just have a little bit, and that sort of explains why you can't just have a bit. So I think that because it is an addictive substance, if you're not going to have it, you have to not have it. And so that's my learning point really, is not to think that, oh, I can just have a cup of green tea and it's almost herbal, that kind of thing. because you can't. So that's that. I was a bit bothered in a way, so this is a bit of a confession really, that I was a bit bothered about saying that I felt really awful yesterday on this video, or that I had what I think is caffeine withdrawal, because obviously then I have to admit that I was drinking caffeine, and there is something, I have a tendency to be very much a perfectionist, and there is something in this whole sort of diet arena that I'm just thinking about around perfection and the kind of quest for dietary perfection, which, you know, I'm on in a way. You know, I want to have the healthiest diet that I can, and I want to be the healthiest person that I can be. But if it stops me from being able to say, you know, because I'm feeling I'm not good enough, then it stops me from being able to say to other people, actually, do you know what? Eating fruit and vegetables is great, or you know, eating a plant-based diet is great, or eating a vegan diet is great. It's miles better than, you know, eating junk food and meat and dairy products all the time. Then that's a problem for me, and it also feeds back into as well something for me about trying to understand what the ideal diet for human beings is, which has been something I've been interested in now for quite a while. And I think other people who are interested in low-fat, raw, vegan, 80-10-10 eating styles, they're interested in having ideal, you know, intake. They're interested in having the optimum diet possible and having the best health possible and perhaps the best level of fitness possible, all of which is great. But I'm just reflecting on the fact that as a paediatrician, as a doctor, I've probably in the last couple of weeks at work seen at least 4 children who don't eat any fruit and vegetables at all, and that's not uncommon. That's probably fairly extreme, but then again, their diet is not that different from what a lot of the children in our country are eating at the moment. And so there's this huge gap between this, you know, what the majority of people are doing and a small minority who are really interested in this, and they're both important. So the next thing I was interested in is the 31st of July and the 1st of August were the dates for a conference that was held in Washington by the Physicians Committee for Responsible Medicine, which is Neil Barnard and co, and they had this conference, which I wasn't able to go to, unfortunately, because it was in Washington, but I was able to sort of follow some of on Twitter, and they were focusing particularly on cardiovascular disease, and they were talking about plant-based diet. They include grains, they include legumes and things like that in the diet, so it's a bit more lenient perhaps than the 80-10-10 sort of fruitarian style of eating. And in that regard, I suppose it might have more appeal, but that doesn't necessarily mean that it's true. So if you want to know what the best diet for human beings is, well, you know, that's very controversial. I don't know that I know the answer, but I'm interested in finding out what it is for me as an individual, and also what it is more generally for people and for my patients and people who have healing to do. So one of the people at that conference was somebody called David Katz, who's a medical doctor with a master's in public health, so he has the same qualifications as me, and he's launched something called the GLiMMER Initiative, which is global lifestyle medicine for mobilising effective resources, and I found that very interesting to look at. I don't know what it's going to turn out to be, if anything, but he's certainly got a I've got a spider hanging off my head. Come here. Down there. Sorry, a bit distracting. Okay, being out in the countryside. So I think that there's been some really interesting movement towards plant-based nutrition generally, more in the States, in terms of healing and in terms of kind of being complementary really to orthodox medicine. And then I've been reading, so there's that, and in some ways I think if you're eating a very standard Western diet, maybe lots of junk food, you know, any move in the direction towards a plant-based diet, towards a you know, a whole foods diet is gonna be beneficial. So there are lots of different versions and variations, and lots of them have people who will testify that they are helpful and have found benefit on them, which still doesn't really answer the question of what's the best, what actually is the ideal diet for human beings, for our physiology.